For those who don't know me, my name is Donna McKay, and I'm the Executive Director of Physicians for Human Rights. I'm told that we have 885 people registered for today's call, and I know many of you, so I can attest to the fact that it's a great group of many powerful advocates working with local, national, and international NGOs, as well as policymaking bodies, all of whom are working to address the numerous impacts and inequalities that are a direct and also indirect result of this global pandemic. So thank you all so much for joining us for the discussion today. Before I turn it over to my colleague, Karen Naimer, I want to acknowledge all of my other PHR colleagues, staff volunteers, board leadership, and partners. As the COVID-19 pandemic has escalated, the expertise and insight of PHR and our vast network of clinicians and others has been in extraordinary demand, probably more than any time in our history. We've been fielding nonstop requests from the media for expert analysis on the pandemic's impact on people, especially vulnerable situations, some of which we'll be talking about today, responding to many requests for collaboration and consultation from partners in the global NGO fields, from policymakers, all related to COVID-19, and also just the general public's unprecedented hunger for reliable information from a trusted source. So today we'll be hearing from experts on the subject of gender-based violence in the COVID-19 world. We welcome your questions throughout today's briefing, so please send your questions to webinar@phr.org, or you can submit them right here on the Q&A box, and we'll do our best to address them. Well, individuals around the world adhere to government-issued stay-at-home orders to protect themselves and their families from COVID-19. Some are being forced into dangerous situations by lockdown orders that trap them inside with an abuser. And we're seeing an alarming rise in gender-based violence and intimate partner violence cases as lockdown orders remain in place all over the world. And overwhelmed governments lack capacity and in some cases understanding to ensure the availability of critical services. So we're really thrilled to have the opportunity to hear from a panel of luminaries in the field of understanding and combating gender-based violence. Their work and insights have been critical at this juncture as COVID-19 has worsened an already dangerous situation for those most at risk. And I'm equally thrilled to introduce our moderator, another extraordinary renowned expert, PHR's Director of Programs, Karen Naimer. Karen oversees all activities in PHR's program work globally, including our research and investigations, training and capacity development initiatives, development of the implementation of international standards, and overseeing a growing network of physicians, nurses, psychologists, and other clinicians who are providing pro bono medical and psychological affidavits to support asylum seekers and their legal claims. Karen's also the founding director and still leads PHR's Sexual Violence in Conflict Zones program, which she'll describe. She is an accomplished attorney with expertise in the areas of international criminal law, international humanitarian law, and human rights law. And prior to joining PHR nearly a decade ago, she was an associate professor at New York University Center for Global Affairs, where she taught international law, and deputy counsel at the Independent Inquiry Committee into the United Nations Oil for Food program. And Karen's work has been featured in renowned outlets, including the New York Times, the Wall Street Journal, the Guardian, PBS NewsHour, the BBC, and many, many more. So Karen, I'd like to turn it over to you now. I'm going to take myself off of Zoom so as not to distract, and I will join you at the end. But thank you all.
Thanks, Donna, and welcome everyone to this discussion about intimate partner violence and violence in the family in the COVID-19 era. At Physicians for Human Rights, we've been working to strengthen responses for survivors and to end impunity for sexual violence in conflict and post-conflict settings. Almost 10 years ago, we established the Program on Sexual Violence in Conflict Zones to strengthen the capacity of doctors, nurses, police officers, lawyers, and judges in the way they collect, document, and preserve forensic evidence of sexual violence to support local prosecutions of these crimes, using techniques that are centered on the survivors and based on knowledge of how trauma affects them. We also cultivate networks of collaboration between medical and legal professionals so they can work with each other more effectively to better support the survivor at the center of the process. In doing this work, we partner with colleagues in Kenya, the Democratic Republic of the Congo, Central African Republic, Iraq, and Bangladesh to bring about meaningful and sustainable changes in attitudes, behaviors, and practices towards survivors to realize their human rights, including access to justice. Rape is a crime of war, but it is also an outrageous everyday occurrence in every part of the world. Before this pandemic, violence against women and girls was already described by the WHO as a public health problem of epidemic proportions. UN Women has called violence against women the most widespread human rights violation in the world. The statistics are well known, and they are chilling. 1 in 3 women in the world will experience physical or sexual violence in their lifetime. More than 80% of the time, this violence occurs in the home, at the hands of a partner or spouse. Research has shown that 38% of all women murdered were murdered by their intimate partners. Nearly 1/2 of all women in the world have experienced psychological violence. And those who experience gender violence and are part of a marginalized group based on race, disability, sexual orientation, gender identity, age, ethnicity, and economic status are at even further risk and often have access to even fewer services. Men may also be victims of sexual violence and can experience violence from an intimate partner. The COVID-19 pandemic has exacerbated the crisis. More than 90 countries are in lockdown, and almost 4 billion people are required to stay at home. Yet while we are in various forms of quarantine to serve one public health imperative, these conditions are escalating another shadow public health crisis: intimate partner violence and violence in the family. The strain and anxiety over the loss of livelihood, lack of power and control, school closures, and the pressures of sheltering in place, often in very cramped quarters, are triggering violence among abusers. Survivors are unable to leave the home, and social and physical distancing have magnified the isolation they feel. Under the constant watchful eye of their abusers, survivors are trapped, unable to seek support, services, or escape. Emerging data from around the globe already shows that since the outbreak of COVID-19, reports of domestic violence have increased dramatically. And we only know about those cases where women were able to reach out for help. The pandemic is prompting a strong public response to recognize health as a human right. But we must also remember that the right to physical and bodily integrity is also a fundamental human right. So is the right to be free from torture. So is the right to redress. These rights are being violated and silenced in the walls of the home. It is against this backdrop that I am honored to welcome our 3 distinguished panelists for today's discussion on the surge of domestic violence in the COVID-19 era. These panelists are leading global experts on sexual and gender-based violence, and they will discuss how existing data and lessons learned can help inform effective responses now and meaningful initiatives for prevention for the long term. We are really looking forward to your wisdom. I'd like to introduce each of the panelists and then invite them to share opening remarks. I'll start with you, Dr. Claudia Garcia-Moreno. Dr. Garcia-Moreno heads the World Health Organization's Department of Sexual and Reproductive Health and Research Unit, addressing vulnerable populations. She's based in Geneva. She has built a career in public health and global health policy with a focus on women's health, sexual and reproductive health, and HIV/AIDS. Since joining the WHO in 1995, she has led the agency's work on gender and women's health and violence against women, including coordinating the WHO's multi-country study on women's health and domestic violence, and co-leading the first global and regional estimates on intimate partner violence and sexual violence against women. She is the founder of the Sexual Violence Research Initiative and chair of the SVRI Forum. She also chairs the independent advisory board of the What Works to Prevent Violence Against Women and Girls program, a 6-year, multi-million-dollar project for research to reduce gender-based violence in low and middle-income countries. Welcome, Claudia.
Thank you. I understood you were going to introduce all the speakers. So you want me to go now?
Yes, please.
Okay, thank you. Well, Karen already made my job easy because she's already presented the backdrop against which we are facing the surge in violence against women. The COVID epidemic has really shone a light on another pandemic, we can call it, now that we are all clear on the definitions of all these terms, that has been there, but has been very invisible and hasn't really received the attention that it merits. So we have already an underlying problem of epidemic proportions that's very prevalent. We have heard the 1 in 3. And we know also that this violence increases in times of disaster, in times of conflict, in times of economic uncertainty, in times of stress, and including in times of epidemics. We've seen this in other epidemics. And we also know that there are many vulnerable groups, including older women, women with disabilities, in addition to those that have already been mentioned by Karen, women who are displaced, refugees, those living in conflict-affected areas, in slum areas. So we have a lot of vulnerabilities coming together. And in a way, COVID and the measures that have been taken to address it bring together a combination of all of the factors that we know increase the risks of violence, from the simple additional exposure of being confined in the home close to a perpetrator or a potential perpetrator, linked to situations of very high stress related to the disruption of social and protective networks, linked to economic the impact on livelihoods, the impact on the ability to earn a living, that in turn may have an impact on accessing basic needs. And we know that all of those factors that exacerbate conflicts and tensions in the home can lead to violence. So we have a combination of all of those increased risk factors coming together. And at the same time, we have limitations on accessing services that over and above, again, the limitations that are already there. We, in many settings, do not have the services available in the first place, and where they are there, they're still limited. They may be limited to just urban areas. They may be limited to certain levels of healthcare facility. We don't have a widespread well-trained providers in primary healthcare that can know how to identify and provide a sensitive response. So, and in addition to that, I think COVID has affected access to services that are provided by civil society. We have heard from many colleagues in countries that they have many challenges in terms of having to reorient their services, sometimes being asked to close down the services, or the services being, taken over for COVID-related facilities or testing facilities. So we have sort of, in a way, a double challenge: the increase in risk and the challenge in the services. We have been thinking and also talking to a lot of people in countries about potential strategies and things that can be done. And I think at this moment, I will just stick to some very broad messages. I think an important message that came early on from our Director General and has been important was to make it very clear that services to address violence against women are essential. They should not be considered optional. They should be maintained. And that we need to integrate these services in preparedness and response plans for COVID-19 and resource them. the second, so that's kind of in a way at the big policy level. I think at the level of the facilities, we need to identify the ways to make services accessible in the context of physical distancing measures. And these may vary and look different from country to country. And, you know, I hope in the exchange we will learn more about different experiences. But as a minimum, we're saying health facilities and health providers should identify and be able to provide information about what services are still available locally, hotlines, shelters, rape crisis centers, and including opening hours, contact details, and to update or establish new referral linkages. Generally increase the awareness of all of those that are coming into contact about the importance of being alert to potential signs of violence and to know what to do, and as a minimum be able to provide a first line support to those who respond. We have guidelines and we have a lot of materials. We don't need to reinvent the wheel in that way, but we need to figure out how do we reach women? How do we reach women in a safe way? There's been a big push and a lot of hype around, you know, telemedicine and digital technologies and et cetera. And that's all well and good in some settings. In other settings, we know that there's still a lot of constraints for women to be able to access mobile phones or have credit or access internet. And the other big concern is about safety. You know, how do we reach women if they are in a lockdown situation with an abuser? You know, how can we reach them in a way that is safe for them? One last point before I stop is also raising the awareness of the community and family members and the public in general. We know that even we know from all our surveys and all our work on violence that most women do not seek help from the formal services. They are much more likely to seek help, at least initially, from a neighbor, a family or member or a friend. So it's really important that we also enable community members and public to be aware and to keep in touch and support women that they are aware are subjected to violence or maybe in difficult situations. I'll stop there, I think, and we'll come back to many of these issues, I'm sure, over the course of the hour that we have together. Thank you.
Thanks, Claudia. Now it's my pleasure to introduce Dr. Lori Heisey. Dr. Heisey is a professor at the Johns Hopkins Bloomberg School of Public Health with a joint appointment in the School of Nursing. She's an expert in the areas of gender equity, social change, and women's economic and social empowerment. She is an internationally recognized expert on the causes and consequences of violence against women and is co-investigator on the What Works to Prevent Violence Against Women and Girls program. She serves as technical director of the Prevention Collaborative, a global initiative designed to support evidence-based, gender-based violence prevention programming in the Global South. Welcome, Lori, over to you.
Hi, it's wonderful to be here today. I thought maybe I just would start out saying a little bit about my position and what I bring to this conversation. I've mostly focused on prevention, the prevention end of this, and one of the, especially in low and middle income countries, and especially around issues of violence against women and their children and the family. So those are my areas of expertise. I don't think any of us are particular experts about what do you do as, when Claudia said, two pandemics intersect. I think the challenge now is very much how do we think about women's safety in two different ways, safety from COVID, and I don't think we should forget, even though we're working on violence, that, you know, that in terms of risks to women's health and children's health, I mean, this is a real crisis in terms of helping people protect themselves and understand what they need to do to stay safe. And then also protection from violence. And so it's two different kinds of safety. And I think we need strategies for both. My background, as I said, is much more in the area of prevention. And some of what we're struggling with right now is our partners, those who have focused on trying to do community-based prevention. It's really quite hard to figure out what priority, what should we be doing right now, especially given the mobility restrictions, and should we be in effect putting some of the prevention activities on hold? Should we be refocusing on immediate response? All of these things are part of the discussions, and I think folks are trying to figure out. I do think it's important when we are talking about violence against women, especially as it intersects with COVID, is recognizing sort of the implications of violence in the home. It actually may bring down violence in some settings where women are less mobile and less exposed, but it's probably going to increase violence within the home setting. And I think we have evidence to suggest that is happening, and how do we respond to that? And that's what I'm hoping that we can talk a bit more about today. Just two things to recognize is that the kinds of drivers, while the drivers of violence are in terms of factors that lead to increased risk are the same, they don't have the same strength in different settings. And so the things that are particularly important, for example, in a rural area of Kenya, and we'll hear more about that, compared to, a high income setting in Islamabad or whatever, are going to be different. And one of the things that's different about many settings in the Global South is that in addition to the other factors that feed into violence, like the stress and the triggering and the economic violence or economic instability, is you have this overlay of a belief system that's grounded in gender inequality. And it very much reinforces the notion that men have authority in the family, that it is appropriate for men to discipline women's behavior, and that violence is frequently framed as a form of discipline. And so some of these ideas also feed into the levels that we see in many of these settings. So we have to like really grapple with, how do we best use this moment in time, and how do we prioritize what are really not enough resources or energy in order to figure out how to be best in service to women. So I'll stop there and we can talk more later.
Terrific, thanks, Lori. It's now my pleasure to introduce Ms. Wangeshi Wachira. Ms. Wachira is Executive Director of the Center for Rights, Education and Awareness, known as CREW in Kenya. It's a national feminist women's organization working to build a just society where women and girls experience full rights and social justice. She has built her career in advocating and implementing programs that contribute to the prevention of violence against women and girls, accountability, and access to comprehensive responses for survivors. Previously, she was a project officer at the NGO Council, coordinating activities on economic recovery and the Millennium Development Goals. Welcome, Wangeshi.
Thank you. Thank you very much. I think for me, my reflection on this conversation and working on the Frontline as an organization that responds, and we've had many years of working on response, but very recently working on prevention of violence against women. We also have a very big component around accountability. I think from the first time the first case of COVID-19 was reported here in Kenya, is that as an organization that is on the front line, is that we have seen a very sharp reports coming from women who are seeking support because they have gone through violence, and the kind of violence that are being reported is either domestic violence, which we also call the intimate partner violence. Because of the schools closing, we have also seen that a lot of young girls also being at a threat of being going through female genital mutilation, early marriages. So this is really a threat. At the beginning, maybe 2 weeks just after the first lockdown, we saw the Chief Justice of the country coming out very strongly saying that in the last 3 weeks, we have seen reports coming to the courts indicating that the courts are receiving about 35% increase when it comes to cases of reported cases of sexual violence. We have also seen the Cabinet Secretary at the national level also acknowledging that there has been a sharp rise, which is about 42%. But also at the regional level, I think we have seen South Africa 2 weeks to lockdown, seeing about 10,000 calls being made of women who are going through violence and looking for help. So the question that we've been asking ourselves, and being on the front line, responding and also working on prevention, that this has also limited in terms of how we respond because of the lockdown, meaning that you can be able to travel out of the town you are in. And also more important is that women who are going through violence, for example, if they're looking for safety measures, they are no longer very, very available. When it comes to issues of shelters, it's still a big challenge, meaning that when they weigh their options, they are not as available as it ought to be. I think we have also been monitoring some of the pathways that are really contributing to the increase when it comes to violence against women and girls. And as an organization that constantly is monitoring, constantly listening to the women, is that we have seen some of the pathway. One is that the economic stress at a family level potentially fueling violence. And I guess at that point is that a lot of families, couples, there is no money to buy even food. People have lost their jobs, their pay cuts, and therefore contributing to a big, being a big contributor to violence against women. I think the other thing that we have also been tracking as an organization is now that the schools are shut, is that we have girls at home, and again, girls being very, very vulnerable to violence. From the report from the Chief Justice in the country, clearly indicating that the biggest portion of the perpetrators are family members. This could be cousins, could be uncles, could even be fathers. So I think around messaging, there's something that really needs to happen around how do we prevent violence from happening at a home level? How do we speak about it? But also thinking more about how do we localize the response? How do we localize the prevention? I think also for me, I would also want to touch that organizations like CREW that are on the front line and other women's rights organizations that want to respond, they're not able to. We have also seen a very, very big shift even in terms of resourcing. A lot of resourcing has directly gone to response to COVID-19, which is rightfully, but I think there is the shadow pandemic, which we call the violence against women. Who is resourcing this? Because a lot of resources are going to government, but also governments are not making commitment. Like, for example, 30% of the resources can it go directly to issues that are affecting women. I think that's something that at the back of my mind, I keep thinking that this is a measure that needs to be put in place. We have also seen other bilateral donors also supporting international organization, humanitarian organization, which is rightfully, but I think there should be also a portion that going to the women's rights organizations that are on the front line, responding to services, and rightfully, because majority of these services are not supported by government, and therefore providing an opportunity that the organizations that are on the front line are resourced to be able to respond to cases of gender-based violence or violence against women, from psychosocial support, which could be online and really messaging. So I'm looking forward to this conversation. I want to stop here because I know we have a lineup of conversation going on onwards.
Thank you, Wangechi. And I do want to open it up to discussion. All three of you have raised really important points that are rich discussion we can pursue. So, Lori, I know you wanted to mention a few points about identifying priorities, which I would love to turn to you. I also would love to flag, in particular, Claudia, you've identified in your work how essential it is to take a multi-sectoral approach for response. And many of you have identified the struggle with resources for priority issues, and also identifying services as essential services for both access to healthcare and access to medical care and treatment for sexual violence. So I'd love to tease out some of those ideas, but maybe Lori, I'll start with you on your thoughts about priorities.
Yeah, I mean, I think one of the things we're all facing is that the system is now under stress because of COVID. And what it shows is how fundamentally inadequate the facilities were that we had in place to begin with, right? And so one of the things that we hopefully can take out of this is that we cannot find ourselves again in a situation where I guess I should say, we want to use this and the recognition that is coming to the fact that women don't have access to services and everything, to kind of pinpoint that and make sure that once this immediate crisis is over, that we can mobilize and make sure that those things are funded in a sustainable way. At the same time, though, we do have to figure out, like, what do we do right now? And it's an exceptional circumstance, right, where people can't move and all of these things are going on. And so in my organization, the Prevention Collaborative, we've been having some discussions sort of about how would we think about the priority things that we need to be doing, and how do we do them in the absence of what women deserve, which is access to good services and justice and the like. So the first one on the list there is shelter. And obviously, many women are in situations where they will need to possibly leave, even if it's overnight or in an afternoon. And our shelter system in many of the places that we work does not exist, or it may be there's one in the capital city. So one of the things we've been thinking about is how can we repurpose temporarily some of the settings that are abandoned now because of people sheltering in place, schools that aren't being used, churches that are not being able to be used. Can we, at a community level, encourage people to use those spaces as places of sanctuary or safety for women in the short term? I think another thing is positive coping. So what can we offer, even if it's very simple things like breathing techniques and calming things, some skills that people can use to try to cope with the stress, the added stresses that this is presenting. And there's a lot of work that's being done around that in the kind of global mental health field and things. So let's pull on that and see if we can make some of that available. I think the big one is safety planning. So what can we do now to try to help women protect themselves and their children in the environment that they're in? I mean, they may be very, very small things, as simple as, you know, we talk to women who do things like they're afraid their husband may force them to have sex and they wear 6 pairs of underpants. You know, I mean, they just do simple things to try to cope with the scenario that they're in. So how do we help women identify those strategies and then plan around them? And then the last thing I actually wanted to bring up is this issue around food and economic security. And I think that right now there's a lot of efforts being made to try to strengthen the social protection schemes that exist in various countries to provide access to cash or food to alleviate some of those stressors. And I think we should be working with that. And as women's groups and others, we should be demanding that those things are actually seen as vital services to also reduce domestic violence and risk to women, as well as to deal with, you know, the economic stresses directly.
I think maybe to just jump after Lori, in addition to the points that she has added, I see a very, very big opportunity to be able to offer psychosocial counseling that is online. And I think at a state level, or even women organizations that are on the front line, as an organization crew, we're already providing psychosocial support or online counseling. And what has happened is that even as we do the online counseling, we're also identifying other spaces, community radio shows, and really reinforcing positive messaging. How do, with the economic stress, how do couples speak about the money available or the money that is not available so that they can be able to cope with the economic stress? What we are also doing as an organization is to strengthen the referral for cases that are reported by ensuring that at least the cases are reported either in police. The challenge you have right there is that some parts of the country, when it comes to reporting the cases, the police are not on the upfront. So there's a lot of impunity around that. And this is because courts are not operating as they ought to be, and rightfully it is. But we have seen good examples, Ethiopia being one of them. Ethiopia, in terms of domestic cases or intimate partner violence, is that they have been prioritized as urgent matters, and therefore they can be heard, they can be determined. And that gives a lot of hope that when we see a region having a best practice like that, can it be adopted by a number of other countries? Shelters are important, and I think we also need to get to a point we change the normative. It's important to get the shelters, and I totally advocate to have shelters in place. But I've been also asking, and we've been asking, thinking through the organization, instead of getting the women out of the house, and when they come back from their home, they come and find a lot of things that have changed in the home. Is it possible to start getting the perpetrator out of the house, and therefore getting restraining orders that whoever is the perpetrator can be able to be driven out of the homestead, so that then within that time, then they can be able to have learned to be able to respect. But also this is going to deter potentially any perpetrator who thinks violating women, they can get away with it, and the impunity that that comes with that. My other one is around strategic partnerships, and strategic partnerships from government, from civil society organizations that are on the front line. Not every cases that are going to be reported in the formal structures. There are very, very many informal structures where cases are going to be reported. And therefore, as government is looking even for data, I think strategic partnership with women's rights organizations that are on the forefront, supporting women, supporting survivors will be very, very critical, because at the national level, and this is not only for Kenya, I'm sure it cuts across very many other countries, data continue to be a big challenge to be able to plan, to be able to respond, and therefore potential places for partnership. I see government and civil society and other groups working together. I'll stop there for the time being.
Great, thank you. Claudia, I'm really curious to know your thoughts about this, because for sure this does trigger a lot of what you've been thinking about in terms of a multi-sectoral response and also data gathering. So where do you see the different roles of the sectors? What sectors should be implicated in all of this? And how do we take that forward?
Yeah, before I answer your question, I'm just going to add a little something to, I think that the priorities that Lori identified, in a way, it's very reassuring because we do have some guidance on safety planning. We do have some guidance on positive coping. There is a lot of material that is being put out by the mental health department of WHO around stress reduction. And so I think that that you know, there's already things out there that can be built on and adapted. And I think one of the challenges that we have is that on the one hand, there is a very acute need to strengthen the services. And I think we need to really use the opportunity to bring attention to the need to strengthen the services and sustain it after the epidemic, because the epidemic will come and go, but the other epidemic that we are talking about is not going to go. So I do feel that the issue of prevention, we need to start thinking about prevention and how, and we put out last year a framework using the mnemonic RESPECT to try to capture some of the interventions around which there is some evidence. And it includes things like working on, you know, strengthening relationship skills and some growing evidence there about things that work. It includes obviously the whole component of economic empowerment and poverty reduction, which is very, very relevant because the next stage, once the lockdown is over, is going to continue to be the big economic downturn. And as economic programs get rolled out, safety net programs, as Lori was talking about, cash transfers or, you know, employment, etc. We need to really be vigilant that women don't get disadvantaged and are not left out of those schemes, because we know that that's an important protective factor for and prevention. The other element is around the norm change that, you know, in some ways it seems there is, as Lori was saying, that there is this backdrop of gender norms that promote certain behaviors, and also how can we use the opportunity to target I think there's a lot of innovation that is happening also, which is something that we need to keep an eye on, in the sense that there's lots of things happening. I mentioned I've been on several calls with country, both government and non-government people. And they were talking, for example, in, I believe it was El Salvador, they're putting out a chat bot for young men, targeting young men with messages. And they had already started to work on it before COVID, but now they've tweaked it to factor in COVID, using radio and television to provide information about what services are available, where shelters are open, etc. And at the same time, using it to send messages around gender norms. You know, I think we need to be thinking of the prevention and the strengthening of the services at the same time, as much as we can. As Lori said, this kind of highlights, and I'm reading some of the questions also in the chat, and I mean, some of it is very challenging. How do we address the fact that in some countries there is, you know, I'm reading here, you know, limited access to justice, weak healthcare infrastructure, patriarchal conservative societies, you know, that we are not going to be able to somehow magically change that. But I think that we need to look for those opportunities, that the attention that COVID is bringing into these issues, you know, can help us to garner support for some of these changes. I don't know if we want to deal with the questions in the chat, or we leave that for later, but I think, yeah, I think that documenting all of this innovation is important, you know, so that we do have a better portfolio of interventions, you know, that we're building on. I think that the other thing, you know, we've put a lot of emphasis in WHO and in our guidelines on training all healthcare providers to, as a minimum, know how to provide a first line support. which is very basic kind of psychological first aid and minimal support and services. And we, clearly we need to strengthen that a lot and continue to push on that. And to integrate, I mean, we have made a huge progress in terms of getting ministries of health and health services to integrate these issues, but we're still not there. And so we need to continue to ensure the integration of these issues. And Liz Pender asked a question about how can we integrate GBB better into the 7-pillar document, the WHO guidance, the 7 pillars, and we are looking at that. We've also integrated it as best as we can into the humanitarian response plan for COVID-19. So I think we need to find those openings, and if people have suggestions about, Liz and others have suggestions about specific things that we can help to strengthen the 7 pillars, please do send them my way, because it is constantly being revised. And so there are opportunities. I think at the beginning we were just, like everything, it just kicked off like Ebola, and then you have to like jump in and do all the advocacy and the sort of slow drip, to make sure the issues are there. But
thanks, Claudia. I want you touched on something that was so important, because we know that without data, that gives rise to plausible deniability, and that's of course incredibly dangerous, because we just don't realize or appreciate the scope of the problem. And so I'm wondering what you all see, for example, as immediate research priorities related to this pandemic. And I know that some of the people posing questions are asking about how do we gather that information in a safe way, and how do we think about gathering that information from particularly vulnerable groups like adolescents or elderly women or refugees, IDPs. There's so many groups who are experiencing this crisis in very different ways. And so how do we think about gathering that data, that documentation, in order to help inform priorities for response going forward? And maybe Lori, we can start with you.
Yeah, I mean, it's amazing the number of phone calls and things I've gotten about this. And I guess I have a slightly different take, and it's maybe perhaps somewhat controversial, but I think there's a lot of people that are not asking themselves, what do we need this data for? And are we the right people to actually be collecting it? So, I don't think we need data to prove that the rates of violence are going up. We have service statistics, we have hotline calls, and we know that this is happening. We have data from almost every setting now that is very good data on the prevalence of violence, not in the context of COVID. Look at that data, use your common sense about people being, sheltered in place and the stresses of all of that, and you've made your case. I think that I don't think there's a legitimate reason to actually be worried about doing research on proving that violence is going up. Or what we do is we do it in a few places. So there are some settings, for example, here at Hopkins, they have a whole huge program that is already set up with remote data collection from women from like eight different countries in the global South that's doing work on sexual and reproductive health. That's a perfect platform. It's already set up. There's people that can actually do it well. So let's let them collect that data. I think for most people, what we should be focusing on is trying to figure out what are people's needs, what are they doing that's working for them, and what, sort of more trying to understand how it's affecting people's lives so that we can better meet their realities. And that, I think, can be done through
Qualitative.
calls, it can be done through WhatsApp, it can be done through a variety of things. But I think there's just this huge interest in doing research right now, and it's attracting a lot of people who have no background on violence against women or how to do it safely. And I guess if you don't have a good answer to how you're going to use that information and why, I don't think you should be doing it. It's just not worth it.
Yes, I have to second that, and I will send you the link to a short, 4-pager that we have done with UN Women on exactly that. And really, I think there's a big push to include violence questions on socioeconomic surveys and this and that, and we share the same concerns that Lori has raised. At the same time, I think that there are things that could be done that are relatively, low resource, that are not necessarily going to have the answer now, but like, just reviewing records, what happened before, during, and after, just like we do for other things. And I think, we saw in Ebola that it highlighted really some of the big gaps that happened in terms of access to services. And I think it is important to understand why why women were not accessing services. Is it because the services were not there because things were reoriented to Ebola or COVID, or is it because they are afraid of getting infected? And and it's probably many different things. But I think I do think there's space for some specific issues to be investigated, but as Lori said, within the context of ongoing research or other things. And in the meantime, use the data that you have. If you have a DHS from a country that's already telling you the prevalence, whether it increased by 1% or 1.5%, or it doesn't really matter. You still need the services. You still need to take all the actions. So use the data that is already there, and only really, I think, Lori said it, be very clear. If you want more data, what is it for?
Great. Claudia, I'm gonna jump in here because I see that we're short on time. So I want to just ask you all one last question, and request maybe it will be difficult, a brief answer, just to be able to wrap up. But we often hear the expression, with crisis comes opportunity. And I wanted to ask you if because this issue is getting so much attention at the moment as a global public health crisis, is there an opportunity for us to bring about some kind of radical transformation in attitudes? And if I can pose a challenge to each one of you, what would be one recommendation that you could hold out to either improve prevention or response to somehow address the challenges associated with violence against women? So maybe Wangeshi, I'll start with you.
I think just to jump into that, I think for me, I see strategic opportunity at a national level. And for me, something like shelters for the country being state funded, very, very, very important. I also see safety net being also a strategic intervention that can be supported by the state. We've already started seeing the cash transfer, but we are insisting that the cash transfer should be able to go to even women households, women with disability. And this is because in our context, when the money comes to home, it is potentially going to fuel or reduce violence. So I see strategic opportunities, also getting women into these leadership positions. And also, as we respond to COVID, it's very, very important to have the women at the center of it in the decision making. We can just we have the biggest population of our women working as on the front line, either being nurses, being doctors, working in this health sector. So it's also important for them to be at very, very strategic decision making positions to be able to bring the change we're looking for.
Thank you. Claudia, I'll move next to you, and then Lori, I'll let you have the last word. Oh, and Claudia, I think you're on mute.
Yes, thank you. I mean, as I said, I think you need to be working on prevention and response at the same time, but I think this is an opportunity to strengthen services. And I do think it's an opportunity because, you know, we are seeing a lot of attention to this from policymakers and even from you know, senior people and ministries of health and others that until recently would not have paid a lot of attention to this issue. So I do think that there's a window of opportunity, and like most windows of opportunity, doesn't last long. So I think we really need to be thinking now about, you know, how do we make sure we don't miss out on this opportunity?
Great. Lori?
So, I mean, long term, I hope we can capitalize and move as a movement to kind of get more funding and attention to this. But I think short term, one thing I think that's very doable is I think if we could just get every country to have a functioning set of helplines with trained counselors who are there 24 hours a day that can do safety planning, can do emotional support, can do positive coping. I mean, that alone is a service. If you go to most countries and you call the number that if you could even find the number, oftentimes you get no one answering. And so if we could actually create a resource out of this where there's people on the other end that know what they're doing and have skills and they're always there, and we blanket through multiple mechanisms the availability of this service and it sticks, that would be a huge asset in terms of coming out of this epidemic.
Well, unfortunately, we are out of time, but I want to thank our outstanding panelists for this really thoughtful discussion. And thank you to all who are watching. We really appreciate your taking the time, especially during this difficult period. And I wish you all much good health and safety. And I'd like to turn it back to Donna now to conclude.
Thank you, Karen. And thank you so much to the panelists for your incredible insights. You raised really important points and priorities that can inform all of our responses, including essential services. To quote Lori, what we should be demanding. So you're just all extraordinary advocates. And it's also great to participate in a conversation that's also looking at the systemic issues that are clearly front and center because they're exacerbated by this crisis, but also seeing the opportunities to inform how we can build better systems for prevention, treatment, care, and accountability and justice. It's clear that our world will not look the same when we come out the other end of this global pandemic. And I think that we all really appreciated today the lens in which you saw opportunities in this moment to strengthen services and build new and different systems going forward. We opened this conversation with you, Lori, acknowledging that there's so much we don't understand about the contours of this pandemic and as it impacts especially vulnerable populations. This is so true. And today's discussion also made clear, though, that there's so much that we do know, that you know, and we need to double down now on what we know works and in support of our frontline partners who really need this community. Wangechi, thank you so much for the work that you and your colleagues are doing to support survivors. Our priorities at PHR in the face of this monumental challenge that is COVID-19 is to make sure that the firsthand expertise and insights of scientists and health professionals and advocates take the center stage to guide the world's response. And we will continue to do everything in our power to elevate these voices in decisions at all levels. And so thank you so much for today's discussion. We hope this was the 8th in PHR's weekly series. We hope you'll join us in the following weeks. Stay safe and healthy, everyone, and thank you.